My name is Teklu. I work for World Vision International as a director for maternal child health, HIV and infectious disease. I've been working for World Vision for the last 10 years. Globally, nearly 7 million children die every year from mainly preventable causes. And in this 21st century, we have the means to prevent and treat these many causes of these deaths. So it is scandalous to see this number of children dying. So our work is actually to change this reality for the better. And in our Health Vision 2020, we want actually to create a world where children survive and thrive. And that's where we are actually passionate about, just to change this reality so that many millions of children will have equal opportunity, like the same number of children who are enjoying good health in the US or in any of the Western countries. For me, it's very personal, and I've grown up in Ethiopia, where I'm probably one of the survivors of many of the odds, where many children die before even they see their 5th birthday. So when I've grown up and went to school, I always want to be a doctor and help children, and save many of them, from deaths or all kinds of, illness. Then, I went to medical school. I got my degree. I started practicing in hospital. And then while working in hospital, in fact, actually, I realized the limitation and how much actually we can reach, through, hospital care, because I was handling or, helping women who come to hospital after going through 24 hours of, illness, mothers in labor for 3 days. And then when they get to the hospital, they are always at the verge of death. So I was convinced that, many of the deaths are happening out in the home and in the village, not in hospital. So I wanted to change that reality. That's why I left, my clinical practice and got, my public health degree. As part of our work, recently we have been working in Zambia to support the Ministry of Health establishing a maternity or a mother waiting room at the side of health facilities. The purpose of this center is many of the mothers, they die during childbirth at home and they don't make it to the health facility. So the purpose of this center is for the mother to come before the time of their birth, so that they can stay there and go to the health facility immediately when they are in labor. That helps to minimize wastage of time during transportation and save many lives, who would otherwise died on the way from home to hospital.